what were some issues at that time that were creating that emotional turmoil where there was pushback or whatnot?
I think a lot of our discussion, I think this is interesting. I think a lot of our discussions, which ended up being controversial, were about including religion in clinical work. Where a lot of social work conversations would be like, you leave it out. Like you don't mix the two of them.
Uh,
And then there were a lot of people who were like in the classes that were like, what about like if there's a religious component to this person's problem? And then sometimes people taking it too far where they'll be like, well, what if I'm a religious social worker? Should I not practice as a religious person in the room? Let's say I have somebody who's breaking one of the laws in the Torah. Should I not say anything? And that was a struggle for a lot of people because the truth is that you shouldn't, because that's not your role. And that would be, I would say that's true according to the Jewish religion, is that you're not stepping into that role as a rabbi. You're stepping in as a mental health professional, and you need to be a different role in this person's life. So I think that was a lot of the discussion. And then sometimes it would go into specifics where, like, what if a client is doing something that's against the Torah, and then, let's say related to the social justice world, how do you treat it? Do you treat it? Are you allowed to refer it out? It was definitely different in terms of like the axioms of social work, but it was I feel like it was the roots of where it's gone over the last 10 years or so.